Right. So now, if somebody suspects that they do have OSA, what are the steps that they should take to get diagnosis and treatment?
Well, I think the first thing is wherever you are in the country, you need to talk to your doctor about it, because although they may not have asked you about it, they will have some idea about how you can go about getting this sorted out. Most DHBs have a facility for investigating sleep apnea. Sadly, because it's becoming such a prevalent problem, or becoming recognised so much more commonly, most DHBs have quite a long waiting list. But that's undoubtedly the first port of call, is contact your GP, see what facility you've got in your particular area, and go through the hospital system. Now, because there's such a flood of people, the hospitals really only look at the most severe sleep apnea, and in some areas it is very severe sleep apnea before they even look at you. So if you think that you've got some sleep apnea, that you've been turned down by the hospital, for example, that they're not going to see you, doesn't mean to say you don't have a problem. And so you need to be looking at other options, and there are a number of private options which are a little bit expensive, some more than others, but would get you treatment very much more quickly. So if you don't meet the criteria for hospital surveillance and investigation, but you're eligible for a disability allowance, it can be put on, WINS will pay for the investigation and for the treatment as well. So it is an option for those who aren't quite severe enough but still have significant symptoms from sleep apnea.
So in that instance, do they seek the diagnosis first, or do they need to go to WINS?
I think the diagnosis needs to be made first, because that will find out whether you're in the category that's severe enough to be seen at the hospital. Because if you're severe enough to see in the hospital, even if it's a year's waiting list, WINS won't touch it. Right. But if you're in that category where you've got sleep apnea but it's not bad enough to be seen at the hospital, which is very severe, I might say, in many DHBs, then they will look at helping you out with that.
We do hear of people who know they need treatment, don't qualify for free provision of a CPAP machine. Is there any other form of funding that people can look to, or are there? And we also hear of people wanting to get second-hand machines, which of course can be problematic.
Yes, okay. So that can be a problem, because if you get, and you can certainly buy them very cheaply over the internet, on eBay or Trade Me, or indeed some people have their relative's CPAP machine that they're no longer using. The problem is that it needs to be set up correctly, and if you just get a second-hand one, it's much less likely that you're going to get the support you need to actually go on and use it correctly.
So the situation there is that this CPAP machine needs to be set at a pressure that is right for you as an individual, isn't it?
Yes.
So that's the part that needs to be attended to.
Yes, absolutely. Yes, there are many aspects to setting up CPAP, and one of them, of course, is the correct pressure. And although in some places they may not be immediately set at the correct pressure, they can work with the therapist to get it right. The other aspect, of course, the most important part, which is the interface between the machine and the person, which is the mask. And unless you've got a mask that fits comfortably, then you're not going to use it, or it's going to be very uncomfortable. So mask and a machine at the right pressure. And although most of the complications of wearing the mask, CPAP, are very minor and can easily be fixed, they can easily be overcome, then you need to be talking to a therapist to do that. Most commonly, that first 2 or 3 weeks is really crucial to actually get yourself comfortable with it. And so often people are left with a machine, maybe set at the right pressure, but they're not given the follow-up that they need to feel really comfortable with it, and they'll tend to say, can't be bothered with this.
That's one of the problems that we hear most when we have our support meetings.
Yes.
So if people are struggling with a mask and they've been to see somebody and they've said, well, you'll just have to live with it now, should they take that as gospel, or should they go back and say, no, sorry, I think we can do better?
These problems that most people have, mask fitting too much pressure, too humid, too dry, it's too tight, they've got it too hard on their face, they're all problems that can be easily fixed. And the therapist, your sleep therapy, wherever you are in the country, should be able to support that and tell you how you can manage that, because they're all manageable. They're minor problems in the whole scheme of things, but they need to be managed, otherwise you're not going to bother. If you went to get a pair of glasses, for example, you don't just buy some. They tend to fix it for you to get it so that it fits correctly on your face and fits comfortably around your ears. Same sort of thing needs to be done. You can't just buy one off the shelf and expect it to immediately fit.
So if necessary, be persistent.
Be persistent, absolutely. And there are many types of masks. For example, most people manage with just a nasal mask, just over your nose. But you may possibly need a full face mask if you have a mouth leak. And if that doesn't work, then often these nasal pillows, they just fit under your nostrils and go over the top, and that's also very convenient for some people.
We've got quite a bit of information about that on our website, so hopefully people will follow up on that if they need more information. What advice do you usually give to someone just starting out on treatment so that they do have a smooth run-in with it?
Most commonly, we have to warn people that it does look funny. There's no question it looks funny, but you're unlikely to see much of it. The advice I tell most people is, yes, it will look funny, but nobody really sees it because you only put it on when you turn the light and go to sleep. The only time when this does become a bit of a problem is, say, with young people, particularly early 20s, who are unmarried and are very embarrassed about the concept of going around to their first date with a little machine saying, "Excuse me while I put my mask on." However, more embarrassing than that is that, in fact, often they don't go to stay with people because they're worried about the noise and they know they're snorers. I get a number of people who, for example, are keen trampers, for example, and they stop tramping because they're too embarrassed because they make too much noise.
Today you can get very small devices, can't you, which can actually help in those situations.
Yeah, so there is a machine called a Transcend, which is a really small, it's about the size of a can of Coke, and it has a 3-day battery, for example, that you can use. So that can easily be used in a pack and taken with you on tramps. In fact, we've got a young man who's on Mount Everest, base camp Mount Everest, demonstrating his Transcend machine. So they are very useful, and there are going to be more of them. The downside to Transcends are they're a little bit more noisy, so they're commonly not used as the primary machine. The primary machine is usually much quieter, but in terms of packing and carrying them, that's a good idea. But there are other options as well that people can use, and we'll perhaps discuss that in a minute in terms of mouth guards as well.
People can also look on the website. We've got information about some of those appliances, so
good.
further work can be done. So what are the common problems that people experience, apart from the ones we've already mentioned? There are some that, mask leaks, those sorts of things.
Yes.
What are the problems?
The most common one, I guess, one of the most common ones is just pressure on the face. So people are trying to tighten it too much. That's a common one. Nasal irritation, so they either get a runny nose or they get a very dry nose, and again they can be easily managed. Mouth leaking, so your mouth drops open and you leak. I might say that most people who are mouth breathers during the day do cope very well with just a nasal mask. It seems that the tongue rides up and stops air coming out of the mouth at night. So most people, even if they're mouth breathers, will cope with a nasal mask. But sometimes they do continue to leak during the night, so that's not so easy. Tossing and turning in the night, most people, of course, with sleep apnea are very active sleepers because they keep, in effect, strangling themselves during the night. So they are tossing and turning, and people worry that I can't move around with it. But the reality is you can actually move around reasonably well with it, and you can lie on your tummy, on your side, on your back, and it will move around with you. But again, the therapist is the person who will talk you through all the little nuances of how to get it comfortable.
Yes. I believe you can also put the hose so that it actually goes back behind your head and fix it somewhere on the headboard or something.
Often people have a little piece over the back so you can loop it over that. Often we suggest it should go under the duvet so that it actually slightly warms the air. But nowadays, a number of the companies have actually solved that problem of the air getting too cold as it comes up to the nose. So most of the companies have solved that one.
Mm. I know that for myself that my partner often suffered with the cold air with certain types of masks, and so
Yes, yes.
again, that's something else you can pursue and check out the website because there's information there about that.
Yes. I think one of the major downsides actually to CPAP is ensuring that the partner is on board with this. Because if you have a partner who's averse to you even thinking about sleeping somebody with a mask on their nose, it's going to be really difficult for that person to put up with it. So if you can, go in to see the doctor with your partner so they can explain to both parties what's actually going on and the importance of using the mask. Then that will you'll solve quite a lot of problems.
Yes, I think once people understand that this can lead to life-threatening problems if you don't, if you're not compliant with your treatment, it certainly takes away a lot of those things.
Yes,
and as you say, the putting the mask on after you've, all activities have ceased and you're ready for sleep, that's the time to put the mask on, and that solves a lot of those problems.
Yes.